This is News Desk. A very warm welcome to you. In our first issue of the morning, pharmaceutical companies in the country have given a month's ultimatum to government to clear its outstanding debts. The companies had earlier threatened to suspend drug supplies to accredited National Health Insurance Scheme facilities across the country. Well, I'm sure you recall that incident with the NHIA and the Pharmaceutical Society of Ghana. But my colleague Abigail Adomankwinchi has been out and about gauging reactions from the public on the subject and the National Health Insurance Scheme as a whole.
The National Health Insurance Scheme is fraught with a number of challenges, and day in and out these challenges come out and it gets most Ghanaians worried. Now the recent issue is that the Pharmaceutical Society is threatening to pull out their services from the scheme. Now that would mean that we'll be going back to the cash and carry system. What do Ghanaians make of this particular issue, and what do Ghanaians really make of this whole National Health Insurance Scheme? Has it failed for Ghanaians? Should we just scrap the whole deal? We'll be finding out. You're live on Joy News on Multi TV and would want to find out from you if you've ever used the National Health Insurance card. First, you tell us your name.
I'm Isaac. I've not used it, but I have it, and I think it's a good idea. But now we've been hearing the hospitals are not taking them. But if they are not taking them, then I'm sorry. Because we are paying for, and it's been deducted from our SNAT and those things. We need to have access to it. So they should do something about it so that the scheme should work. It's for the good of the general public, not an individual. So the government should put on structures so that it should be done very well for the good of the people.
I'm just curious, why haven't you ever used the card? Is it that you've never fallen sick, or you just don't feel like using the health insurance card?
Oh, God being so gracious, I've not fallen sick. So if I fall sick, I will use it.
Right, now there are reports that the Pharmaceutical Society is threatening to pull out their services. It means that would have to pay for our drugs when you go to the hospital. What do you make of this particular issue?
It's a bad news for the nation, and I think the people in charge should do very well to fund the Pharmaceutical Society so that they will be able to give the drugs to the people. Look at this cholera, which is disturbing the nation. And if all these drugs are pulled out, the nation will come to a standstill. So we should do something. We should bear in mind that Ebola is also on its way. And they are saying maybe at the end of this month or early next month, we are at risk. So we should do something. We should prepare for this great occasion, so that maybe the people in the nationalists will also benefit from this thing. So I think the government should sit up and do something about it.
Now finally, before I let you go, do you think that this particular scheme has failed with the issues surrounding it, a number of challenges day in and out?
I will not say failed per se, but the government should sit up. That is what is the most important thing, is that the government should sit up and look into it again, so that everything will move on smoothly. It's for the general good of the people. So something which will benefit the people and the nation. A healthy nation, a healthy people is a healthy nation, and the nation will move forward. So we should do something about it.
All right.
Yeah.
Thank you very much, Isaac, for speaking to us. So we'll try to get more people to get their thoughts on this particular scheme, and they will tell us if they've ever used the health insurance scheme. You are live on Joy News on Multi TV. We are talking about the National Health Insurance Scheme and the experience that you've had as a Ghanaian, if you've ever had. You tell us your name, and then you tell us if you've ever used the National Health Insurance Scheme.
I'm Abdul Rashid Mohammed, but popularly known as Razbingi. I was registered on the health insurance in the year 2005. I've been utilizing it. No, it's very good, but some of the health personnel, I think, are the reasons for the breakdown of national health insurance. You go there, they overbloat the monies. For instance, if you are to pay, let's say, 2 cedis, they take it to 3 cedis, 5 cedis. And something like that breaks the system. Also, the way they treat clients or patients that are with the health insurance is different from treating the people that are paying, that is cash and carry. So you could see that people rather fail to use the cash and carry system than the health insurance due to the way they are being treated when they go to the hospital. So my experience with the health insurance is good, but the personnel working at the health facilities are the problem.
Now, let me find out from you. The Pharmaceutical Society of Ghana is threatening to withdraw their services because government owes them some sort. What do you make of this issue? It means that we would be going back to the cash and carry system, and indeed, it would render this whole scheme useless.
Yeah, I'm not comfortable with them withdrawing their services because the health insurance has really helped people. Should we go back to the cash and carry system? It will be a disaster for the nation. I know that. So we appeal to the government and the other stakeholders in the health insurance to sit them down and negotiate, because I believe in negotiation. When you negotiate, there will be a consensus, and I think they will come back so that each of the two groups, that's what they are supposed to do, and we go back. For going back to the cash and carry system, no, I don't think it's going to help us. It wouldn't help us.
But are you satisfied with the scheme itself? Because something that it has failed, looking at the numerous challenges.
I'm somehow satisfied and somehow not satisfied. Why do I say that? First of all, you consider when it started, the number of people that were registered on the scheme is a factor to consider. And now the number of people also on the scheme should also be a factor to consider. And as I said earlier, the behavior of the health personnel, you see, the institutions are there, but the people within are those that are collapsing the health insurance scheme. You understand? For instance, when this capitation was started in Ashanti region, I think it has helped a lot. So I will call for behavior change, you understand, from the personnel working at the health insurance offices and those are the health facilities, and I think there can be something good out of it. But if we don't change our behavior, that is the personnel at the offices and those are the health facilities, then we should forget the system will still collapse as it's doing.
All right, thank you very much. Let me try to speak to this young man here. Yes, he was with us. Okay, so sir, you're live on Joy News on Multi TV. You're talking about the National Health Insurance Scheme. Okay, and would want to find out from you. I'd explain to the viewers that you speak to me in Akan, but then who say National Health Insurance card no. Abwa na say unyusu bida. Who say what's your use wafa?
Yeah, abwa me. Because na say na me ko ye surgery enu na aboa me pa drone discharging fee ni na aboa me.
Say you must share one when you ho.
Yeah, when you ho, but sometimes attitude of the personnel no hard you pa anti as a government here be far.
That's not more day.
Oh, sometimes we need careful. Or make a say I didn't know cover. Wow. We need careful. Or make a say cover. To me, say no media no almost uncover, but many years did miss a call back to the office no. And no more catch me say you might cover me winning now.
I see. Now, see, pharmacists for also say government do more cabintino and show you or withdraw more services, not just say ukwa ubetia unro and wadeka and no join Hussein.
Yes, the government into a sacan because one to have you a high pa because media a drone a cover drone into say 1 year I have high 1 2 or more a behind you.
Now, National Health Insurance Scheme, who amani bebre. Now, no, Odrin will say, Yamani Wawana say, Yen Tungu Crani and Yabi before for a crowd together.
Oh, Yamani Waho. No Muka Satre I don't know, staff no, my mom we no more change your more attitude. But yeah, man.
And that's a person Akasa. So he has been speaking to me in Akan, and he's saying that the health insurance scheme is very good, and he has used it and it has helped him a lot. Just recently he had to undergo a surgery and he was covered by the insurance scheme. But then personnel, the attitude of the personnel in the various health institutions is what is collapsing this particular scheme, because he was told that the insurance was not covering his expenses, but then after pushing further he was able to pay up through the national health insurance. And so the personnel that really oversees this particular insurance scheme should be up and doing. For them, that is the challenge. You remember that earlier I spoke to somebody who also shared the same views. We'll be getting the thoughts of other Ghanaians on this particular issue quickly. We have another person here to speak to us, but she will be doing so in a can again. Mami, good morning. Me pacho or join you so. You see who say national health insurance card no. Where you should dana ete was saying we see no.
Actually, yeah pa. Yeah, say me play no kran. It's a room me pa. Yeah.
Now kwa any share we ye dear one tua sika bebre bia.
Pacho men tua sika kra. Wamu ye operation ni nyina men tua hwe. Tim say yeah pa.
Oh, yeah, dear, yeah, necessary no. Pharmacists for no so say government do omo kabinti no. Omo ba be jai ejuma no omo ye no na. Inti no ko hospital a edura wo beto no wo betua ansa na ye dia ma. Odwen wo saying.
Me pam chunk e ka men kwan de anka omo me nyai. Anka yen kɔ so enye if say eboa ahiafo. Inti eye.
Government enye den fasa asem we ho omo ode omo ka no
ba cho e ka no ontutu wom se de be ya obetua ne nkakra ama wo na ade no akoso
na health insurance is what te ho nsem bebre say e ho nsem dooso enka eye wo pemu anka den pa na enye mfa ho a ebetimi asesa no
se ne sisi ade ekoso ya no ade ekoso no ne nyina bebre fi wo ma ye insurance no wo ma na bebre fi wo fi se scan kra bi abande kwa ye mfe nko nti se wo ma ye sa ade na se change wo ne ye penipa wo mo ye isuro nyame ne ye ko ti musumasa
me da se pa ma so ne akasa. Okay, so her view is no different from the others I spoke to earlier. She also thinks that the main problem is the staff working with the national health insurance, on that particular scheme, from the health officials to even the authority. They want some sort of change. If this particular scheme is to work, then there should be some behavioral change, because when people go there, the attitude they give them, and when the monies come in for this particular purpose, how it is utilized is not the best. And for most Ghanaians, as you have already heard, that is the source of the problem, and that should be addressed immediately.
Well, thank you very much, Abigail Ademako Enchi, for that report on the situation between the Pharmaceutical Society of Ghana and the National Health Insurance Authority. The pharmaceutical companies in Ghana have given government a month's ultimatum to clear its outstanding debts, or it will cut the supply of pharmaceutical products to service providers under the National Health Insurance Scheme. We're putting in efforts to raise parties to the matter over the telephone. It's proven to be challenging, but in the course of the program, hopefully would raise both the Pharmaceutical Society and the National Health Insurance Authority over the telephone. In the meantime,